Welcome back, Richard. It's good to see you again in a new environment for you.
Yeah, another new environment, at least for today.
Yes.
And I keep forgetting to update Zoom, so I can't get that virtual background. So that's not a Christmas tree behind me. That's actually the tip of a canoe.
It's like a tip of a canoe, yeah.
A model of a boat. Upright. So, and there's a flower in front of it. I looked at it this morning and said, oh, it almost looks like a Christmas tree, but
yeah,
didn't have time to dismantle the whole thing. So it's just a canoe, but it's January.
It is.
January 9th, and flying into another year.
Yes, we are. And we sort of started this for the new year, and we're going to continue our conversation again today with talking about oppositional behavior. We're going to talk about challenging behaviors in students and kids, but today we're going to focus on adolescents, teenagers.
Right.
That I was talking to a person the other day about middle school, and those 3 middle school years have to be some of the most challenging years for teens and preteens, but also for parents and teachers. And I think everyone involved with preteens and those middle school years struggle. That's right. That's a tough time. We're going to talk about challenging behaviors in those middle and high school students, those preteens and teenagers, because it is different than what we talked about last week with younger children.
Yeah, it really is. When you talk about oppositional children, and all kids to some extent are oppositional. I mean, everybody, and they're supposed to be. That's how they become independent and learn how to function on their own. And so they're always sort of pushing back on us, starting with the terrible twos.
Right.
But it goes across a lifetime, and kids eventually settle down as the brain matures. We wrote that book on the middle school mind, the brain of a middle schooler. And so what we want to talk about today, though, is not the normal oppositional behavior that almost all kids, no matter how compliant and cooperative they are, there are some kids who become so oppositional that it becomes a real area of concern. And that's what we want to talk about today: is how do we move from normal oppositional behavior to pathological oppositional behavior? And when you and I looked this up, I mean, you talk about thousands, right, maybe millions of articles. I mean, the information goes on and on and on. So there must really be something to this notion of oppositional behavior in, now we talk about tweens and teens,
right?
Because this in-between group,
right,
childhood to adolescence, is also a challenge. And one of the things we want to remember is that teenage behavior is worse. It's at its worst when kids first hit puberty. Mm-hmm. The early teenage years are the worst, okay? Over time, as they get to middle teens and later teens, like high school seniors, they begin to settle down.
Right.
Okay, so we're really talking about these young teenagers. Last week we talked about kids. We said, where are the worst problems? Preschool and kindergarten. Okay, right. And for teenagers, it's the early teenagers that are having the most problems. Okay,
right.
And so, but what we want to talk about is not normal oppositional behavior, but behavior that is so persistent and so difficult that we have a name for it, and that's right, called oppositional defiant disorder.
Right, and I think that there is a difference between the two, and I think that many times parents and teachers and anyone working with this group of kids, sometimes they struggle even with the normal teenage behavior, because that behavior in and of itself can be challenging if you're not prepared for it. And I think that our experience tends to be that the parents or the individuals who struggle with it the most are those who aren't anticipating it. They think, I have this kid that grew up and he was so loving and he would tell me everything, and he would, talk to me, and he would, snuggle with me on the couch and watch a movie and everything. And now all of a sudden, he's 12 or 13 years old, and he won't even say good morning to me.
Right. Right.
Yeah. So that significant shift that happens, and for many parents, it feels like on a dime. It feels like it happens immediately. Can be unsettling for a lot of parents and folks working with these kids. And so that lack of preparedness for it is what really shakes some of these people.
That's right. You have to prepare for that separation that kids are going to do. How many times do we hear, he was my best buddy. We went to the hardware store together. We went to Lowe's, and we'd cook and we'd camp and do all these things. Right. Now he won't have anything to do with me. Like, he hates me. Okay.
He stays in his room all the time.
Won't talk to us. Doesn't share anything. He used to share everything with me. Now he doesn't tell me anything. That's right. It's a normal part of the independence seeking that teenagers must go through.
Right.
They have to go through this period. It's going to happen sometime. It usually happens in the early teenage years.
Right. Absolutely. So when you think about that normal teenage behavior, what we're talking about is, there's a uptick in their emotions. They have more intense emotions, positive and negative. Emotions, and they have pretty quick changes. So they'll go from being really happy and excited to being somewhat irritable and agitated, and that may seem very quick to people sometimes. And it's not bipolar disorder. It's not any of that stuff. It's something that normally happens in teenagers.
Right, and they become resistant.
Right.
One author calls it counter will, and we could almost do a separate podcast on counter will. But as the name implies, it's they're expressing their will, okay, and it is probably counter to what we want them to think or do or feel. So, but it's theirs, and so there's that, we feel that resistance to what we want them to do. They used to be so compliant and cooperative, and now it's like we fight about everything.
Right, and fight about things that you often feel are fundamental to who you are. So, a lot of times you will have kids who grow up in soundly religious homes who, decide that they want to be atheists, by the time they enter adolescence. And it's like, well, wow, where did that come from? Because it's such an antithesis to what our family believes. You have, we've talked before about, kids who grow up in, hunting homes where, the family goes hunting and, eats meat and has the, beef, it's what's for dinner type of tags on their truck, and they become vegans. They decide that they're not going to eat meat anymore. So it's like that counter will, that attempt to differentiate who they are from where they came from, is part of that identity development that kids go through, that teenagers go through, to figure out who they are. This is who they've always been. And so they want to make sure to see if this is who I am over here. Am I something different than what I've always been? That's
right. And so that's the normal stuff that kids do. They're trying to figure out, where do I fit in? What's my group? What's my, am I a jock? Where do I fit? And they also experiment with everything. They experiment with stuff. They try things. Most kids will try drugs and alcohol because they experiment with everything. They experiment with their sexuality, with their religion, with the foods that they eat. And they push back. They push back against the order that we established when they were in elementary school. That we had this life that we created. Well, that's the very life that they're going to push back against, because it's the only life they've known.
Absolutely.
So they push back on what we established. And you say, well, why is he attacking these things? Because these are the things that they know. Right. And they push back against that established order that we had in earlier childhood. They're going to be disagreeable. They are becoming their own person, and to do that, they have to exercise their will. That's what we mean by counter will. Okay. The other thing is that because they have intense emotions, they are going to occasionally slam a door. They're going to you're going to get sighs of disgust. how many times, Berney, I think you were the first one who said, I don't care if you want to do it. I just want you to do it.
Right.
You can protest all you want. It's okay. I don't expect you to like cleaning a bathroom. I just want you to clean the bathroom.
I don't like it either. So, I mean, why would I expect my kid to like doing it?
Right.
And want to do it enthusiastically when I don't even want to do it? I mean,
I want to be happy about it.
The whole reason I'm asking him to do it is because I don't want to do it.
That's right. That's right.
That's what we do. But and so we're not saying that all of this stuff is okay. That it's okay that, you know, the kid wants to experiment with different things, or that they want to push back so hard, and sometimes they push back very hard,
Right.
and very overtly and really in your face type of pushbacks. And we're not saying that that's okay and that there's nothing that we shouldn't do anything about it. I just allow it to happen. We're just encouraging you to recognize that part of that is normal. And you know, if you're, you know, 16-year-old, 17-year-old comes home from after the football game party, and you know, you might smell a little bit of alcohol on his breath or something like that. It's not something that you should, you know, call in and send him to a residential facility and do all that kind of stuff. Something needs to be done, absolutely.
Right.
But we're not going from 0 to 150, because part of that is normal behavior.
That's right. Because what you say to yourself when you first encounter that, and most of us encountered it, is you should say, oh, okay, this is what they told me my son is experimenting. It's not my son is on his road to addiction.
Right.
Because chances are they're not on their way to addiction.
Right.
Because in fact, most people don't become addicted to substances. Okay. So right. Statistically, it's not the slippery slope to addiction. It is, okay, we're experimenting. Yes, you have to do something about that, but you don't need to bring out an iron fist. You know, that's not what it requires. This is normal teenage behavior.
Absolutely. So when we think about the difference between some of those normal variants of behavior and what we really consider to be problematic, oppositional, right. Sort of pathological behavior, there's three things that we look at. And we look at the frequency, how often does it happen?
That's right.
Persistence and the prevalence.
Right.
And we look at those three things and how they sort of the relationship between those things to try to differentiate between typical and atypical behavior.
That's right. And that's a really good thing for parents and teachers to keep in mind is frequency, persistence, and prevalence. What we're after here is when we want to move from normal behavior, normal teenage behavior, as crazy as it sometimes is, because it is illogical. There's a wonderful book said, "Yes, your teen is crazy," is the title of it. Yes, they do act crazy in some ways. But when you move to pathological, when you move to a diagnosis, you have to think about these three things. Right. That's what we're looking for. And so to qualify for a diagnosis of oppositional defiant disorder, it has to be around for at least 6 months. I mean, it's not the first time you encounter something.
Right. It has to be around for that long. And it has to, and what we mean by persistent is that it's, and prevalent is that it persists in all settings. Right. So it's not just, man, he's really that way with dad, but everybody else, he's okay. You know, everybody else thinks he's wonderful and he's very compliant and everything, but he just behaves that way when he's with dad or when he's with mom or when he's at school. Everywhere else, he's okay. It's just, that's probably not pathological. That's probably environmental. And we need to think about what's happening with the dynamics of those relationships that could be causing the behavior.
Yeah, that's a good point. If you're only oppositional with your mother, then it's not ODD. I mean, it's there's a problem, yes, but it's not ODD.
Right. Yeah. And so, you know, but the challenge comes with when we look at some of the behaviors associated with when we think about oppositional defiant disorder. Again, we're talking about a lot of these behaviors that can be very typical for this age group. You know, we're talking about like aggressive behavior. You know, sometimes some of these things are subjective. You know, if my parent asks me to do something and I say no, I'm not going to do that. You can't make me.
Right.
Some parents will see that as aggressive. Right. Others will just see it as resistant. But either way, that's sort of a subjective thing with that. So
yeah, typically we're talking about physical aggression, kids who hurt other kids. Either little kids, when they're younger, they hurt other kids physically, but also being aggressive emotionally or verbally, or online, cyberbullying.
Right.
So it's that you just feel that underlying aggression, like you get the feeling that they'd really like to hurt somebody in some way. Okay?
Right. Yeah.
Blaming others for the mistakes. This is a very, again, the dog ate my homework kind of, that's all very normal. But when you get these kids who consistently blame somebody else for what they're doing, that could be a red flag. That could be a symptom.
Right. They never apologize. They never say, "Oh, let me fix that," or I'll do something different next time. They don't at all take any accountability for their behavior. So, but again, thinking about some of that subjectivity with some of this, one of the criteria is deliberately annoying other people. It's like, okay, is he deliberately annoying me, or is he just annoying? I don't know. I can't tell.
And I think this is that kid who, you frequently will have families with 4 or 5 children, and there'll just be one kid who just is tormenting everybody. That's what parents say. He's just always tormenting somebody. He makes his sister cry. He goes into her room, he takes her stuff, or he takes his brother's stuff. But it's this recurring, it just goes on and on and on. All kids do that on occasion, but these kids seem to be annoying others. It's almost like they're here to annoy other people because it's so consistent.
Right. And I think that this is where and we mentioned this last week, this is where it's so critical that you get a professional who is familiar with child development and working with teenagers and young and preteens, because to a parent, a lot of this stuff is going to feel deliberate, it's going to feel intentional. Other criteria is about temper tantrums and angry outbursts and refusal to follow directions and rules and things like that. But you need to get a sort of a third eye on it, if you will, sort of another person's perspective to look at the behavior, because yes, it may absolutely be that your kid is deliberately attempting to cause arguments and fights. Again, with what you were just talking about, deliberately annoying others, a lot of times parents will come in and say, like, we could all just be sitting there and everything is going just fine. And all of a sudden he'll just say something to make his sister angry. Or he'll just say something out of nowhere that just is infuriating. So they see that as deliberately attempting to annoy someone. It could be, but it also could be impulsivity. It also could be he's trying to be funny, but he's not successful. It could be lots of different things, but you need that other person to look at it to talk with the kid to really tease that apart.
Right. I have a family now that I've been working with for years, and the older child has always kind of gone after the younger child, teasing, making her angry. And this has now been going on for more than 5 years. And now they're becoming teenagers, and he's still doing it. That's what we mean by persistence.
Right.
I mean, he has never let up on this younger sibling. We don't know whether it's jealousy. We don't know whether it's because he was an only child for 7 years and now he has to share the attention. We're not sure. But from the time that child was born, he has been tormenting her. That's what we mean by persistence. And it's over and over. And it's about multiple issues. It's not running into a room and teasing her about something. This is just a daily thing that this family's dealing with.
Right. Yeah. Now, the good news is, good news, parents. The good news is that if you have a kid who, through their childhood up until adolescence, everything was fine. You didn't see any of these behaviors. There were no the kid wasn't oppositional at all. Very compliant. But then all of a sudden, now in adolescence, they're demonstrating a lot of these oppositional and maybe even meeting criteria for oppositional defiant disorder. The good news is that the research suggests that they typically work right out of that process, and a lot of those oppositional behaviors, by the time they end adolescence or get through adolescence, a lot of those behaviors go away. The real challenge is when the earlier these behaviors begin, the more persistent and prevalent and the poorer the prognosis is. You know, the more, if you think about it, the more chronic anything is, the more problematic it is. So at the earlier ages, if you start getting these oppositional behaviors and they continue, that's a real concern.
Right.
If you have a 15-year-old that's never kind of pushed back at all, and now all of a sudden he's pushing back a little bit,
chances are that's a teenager. Right.
Yeah, odds are by the time he's 18, he'll have worked through that and everything will be okay.
And conversely, we have behaviors that we expect in young children that we don't expect in teenagers. For example, when we talk about oppositional defiant disorder, one of the symptoms is frequent and intense temper tantrums. Well, those are normal in preschoolers. Okay, but if a 9 or 10 or 12 or 15, especially if a 14 or 15-year-old is still having frequent temper tantrums, that could be an indication, because it should have gone away.
Right.
So you have two decisions. One is my teenager doing something that is completely inappropriate for that age, and a temper tantrum is inappropriate after age 5 or 6.
Right.
So that's one problem, is does the behavior continue beyond a certain age? And the other thing is, did it only appear at a certain age?
Right.
Like what you were saying, if your teenager suddenly becomes annoying, okay, probably a teenage thing.
Right.
Okay? But otherwise, because what most of these kids do is, if you follow them over time, there is this pattern of behavior that goes on for years and years and years, expressed a little differently at different age levels. Right. But it didn't start during the teen years. It wasn't a sudden change.
Yeah. So as we kind of work through this, we have to recognize that, again, some of these behaviors, a lot of these behaviors on that oppositional defiant disorder list are present even in typically developing teenagers that don't have oppositional defiant disorder. They're there. They're maybe not as frequent. They're maybe not as persistent, but they may be there. But we have to recognize that we have this tendency to look at teenagers who behave like this. Again, whether they're oppositional defiant disorder or not, we tend to look at those kids, and those kids then become those behaviors. And so when we look at them, that's all that they are, is that kid is just oppositional. And we fail to really appreciate all of the other things that the kid does, all the more positive things, all of the good things that may happen. We sort of push those to the side. And people that we've mentioned before, like Ross Green, he says that this isn't necessarily an accurate picture of what's going on with the kid.
Exactly. Right. And so there are these symptoms that are in DSM-5, because we are talking about a mental health condition. Okay. So we talk about temper tantrums, refusing to follow rules, being very spiteful. Kids who are spiteful consistently. It's almost like they're looking for ways to get even. They're revenge seeking, and they're seeking revenge actively. And then questioning authority repeatedly, not questioning us once in a while. They're supposed to question us periodically, parents and teachers. But there are these kids who just grind you down, where everything you ask, they question it, and they want to argue with you and get into these verbal discussions and debates, and it wears you down. It wears the parent down. That might be a problem. Okay, because what you have with these symptoms, and these symptoms are going to be in the show notes today. So you have these symptoms that are in the diagnostic and statistical manual. But as we've talked through them, we keep saying a lot of this is normal, so you look at these symptoms, well, my child's spiteful one, or my child questions me, or has outbursts, or slams doors. So how do I know that it's a symptom of a disorder versus normal behavior? So what Ross Green took that issue, and he developed another way of looking at this. And in fact, he has a name for it. He calls it inflexible explosive behavior. And the symptoms and the characteristics that he gives are much more descriptive. And so it's the same thing. It's still oppositional defiant disorder, but it's in terms that are much more descriptive, and I think give a much clearer picture of what we mean by oppositional defiant disorder. And he clusters them into three types of behaviors.
Right.
One is low frustration tolerance, one is rigid thinking, and one is they're easily ignited. And so that's another really helpful way to differentiate, is it just normal behavior, or is it something that should concern me?
Right. And so clearly what we're referring to with a lot of this stuff isn't just, well, he's not doing his homework, or he keeps leaving the bathroom towel on the floor. We're talking about more overt oppositional behavior. So, when we think about like low frustration tolerance, what he is talking about is, these kids become angry and frustrated like over the littlest things.
Right.
And it may even sort of make you remember those terrible twos where it was like, man, what happened just because we're not having chicken nuggets for dinner? He's having a horrible temper tantrum.
Right.
It may be something similar to that, where it's just this out of nowhere. It's like, what is going on? He becomes so frustrated and so angry over nothing.
Right. A change in plans. We were going to go here, but now we have to wait an hour. And most kids can handle that. They say, oh, okay. Or they might get angry and say, oh my gosh. But they handle it. Okay. These kids don't handle that sort of thing. That's a very low kindling temperature. And they ignite, not ignite, but they cannot handle even the simplest changes.
Right.
Okay.
Yeah. So there's that easily frustrated, they can't control it, they can't manage it, and so it leads to them being argumentative. It leads to them being, some of those temper tantrums that you were talking about. Again, you kind of go through those criteria of oppositional defiant disorder. You can start ticking off some of these things that just by having a low frustration tolerance, you can see a lot of these behaviors.
Right, that's right. And the second thing that these kids have is rigid thinking, and that comes with low frustration tolerance, is that they tend to think in very concrete black and white terms. They're always looking for, you said this was going to happen. And if you said that was going to happen at 10 o'clock, then by golly, it better happen at 10 o'clock. That's what you said. You promised. And you hear this frequently from kids. And there isn't that flexibility of thinking and say, okay, she said it was 10, but it's going to be 10:30. Most kids, most teenagers can handle the variability. These kids have a hard time with that.
Yeah, and parents will see, using that specific example, parents will themselves become so frustrated with we'll just call it a double standard, because they'll say, well, if I say that something's going to happen at 10 o'clock, my kid is like really agitated if it doesn't happen at 10 o'clock. But yet if I tell them that they need to be home at 10 o'clock and they come home at 10:30, they're like, what? It's basically the same thing. I'm just 30 minutes late. It's hardly anything. So that inconsistency, because while their thinking is very rigid, they can rationalize things from their perspective, but they're not going to be able to rationalize things from your perspective.
That's right.
And so for them, 10 to 10:30 for something that they need to do makes perfect sense. But changing from 10 to 10:30 for something for you, that's unacceptable.
Right, exactly. And it does make a difference, because once they make a decision, then it's very difficult to see any other perspective or any other alternative. Right. Absolutely. And the last thing, and probably the most troubling to most parents, is when they ignite, when they explode. And this is really maybe the hallmark of this disorder, is these kids, they're older childhood, like 10, 11, these are tweeners, between childhood and adolescence. We don't think they've hit puberty yet, but so it's pre-pubertal and early teenagers, and they're still igniting. They're still having tantrums. They're still having these explosive outbursts. And that shouldn't be happening at this point in their lives. The other thing is that the ignition occurs for no apparent for very little reason. It just takes very little to upset them and to get them really fired up.
Right. Yeah. And it's fascinating because again, this is where having a professional come in and work with you is so important, because absolutely to parents and to other people working with these kids, it may seem like it's out of nowhere, that there was nothing that provoked it. It just, whereas from the kids' perspective, it was this happened and this happened and this happened, and
Right.
I've had enough. So from the kids' perspective, there could be absolute justification for their behavior, but nobody else knows that. Nobody else sees that. It's all internal things. Oftentimes the kid has no idea why it happened. They'll say, I don't know. And it may be true. It may not be true. We don't know. But in the end, it appears, at least from the outside, that these things are triggered for no apparent reason, and we have no idea where it comes from.
Right. And that's why we think that's why we think there's something different about the brains of these kids, that they are getting upset. Anybody would get upset or disappointed. You say, well, we can't go to the beach today. I know the car's packed and we were going to do all these things we can't go today. Mm-hmm. Yes, there's disappointment, but these kids, for them, they just fall apart. We talked about the wheels fall off. They just fall apart because either their emotions are much bigger, or their ability to inhibit those emotions are much less. Okay, so but we really don't know. And when we talk about why does this happen, we're sort of asking the question is, well, what is the cause of ODD? Okay, and we really don't know.
Right. I think about it and often talk to parents about it like a campfire type of thing, right? Or a bonfire sometimes.
Yeah.
When the fire is raging, you can see it, and you have to be careful because it could get out of control. But there are times when there's just the embers, right? And if it's daytime and you're looking at it, it may just look like coal laying there on the ground, and you don't see anything happening or anything. But then this little bit of wind comes through, and all of a sudden there it goes again. And that's what happens with these kids, is that sometimes they can appear perfectly fine, they're calm, everything is just okay, but this little gust of wind comes out of nowhere and just provides the oxygen needed to really get that flame rolling again. Again, apparently out of nowhere, and the parent could be the one that provides that little gust of wind, or some hormone or something else inside the kid could cause that little gust of wind.
Right.
And it just happens.
Right. Now, if we're thinking that this could be ODD, and we say, what are the causes of ODD? Where does this come from? It's almost always the result of some deeper issue.
Right.
Okay. We don't know what it is, but something is going on. And most authorities believe that oppositional tendencies tend to mask some pain or fear or anxiety that resides in the child that shouldn't be there, but it is. And so there's one author who sort of she considers three root causes of defiant behavior. And one is trauma. And we don't really, trauma affects people differently. Some people are very resilient. They can experience something and they seem to be able to handle it okay. Other people are more brittle emotionally, and the same amount of trauma creates more anxiety or more emotions, creates bigger emotions. So trauma is one. There could be something wrong. Bruce Perry asks that wonderful question of what happened to you.
Right.
That if you're, and this is especially true for teachers who encounter a teenager, or somebody who doesn't know the child's history. Right. Will say, well, why is this kid acting this way? Well, one of the questions is what happened. Bruce Perry is right. What happened to you? What happened in your life that could have created this pain or this fear? Right. The other is anxiety, and I think this is what I see most frequently. Is I see kids who have ODD are many of them are highly anxious. Yeah. It doesn't necessarily have to be obsessively anxious, but they just live in this very frightening, unpredictable, unstable world.
Mhm.
And they can't, they're sort of always on edge and always ready to either run away
Mhm.
or to fight somebody,
Right.
okay, because of the anxiety. And the third is insecure attachment. And we all know about reactive attachment disorder
Right.
and different disorders of attachment where a child just never attached to a nurturing adult, either because the child didn't want to or didn't have an adult who was available.
Right. And I think that this is another one that's very common because that not necessarily all the way to the level of a reactive attachment disorder, but when parents are, when a kid grows up in a very authoritarian home, oftentimes you see sort of this rebound effect where the kid becomes very oppositional.
Right.
As soon as some of those hard corporal punishments, hard disciplinary approaches that
Right.
parents who are authoritarian tend to administer, as soon as some of those things are taken off the table,
Right.
you see this rebound where the kid becomes very oppositional, and it is not necessarily to the level of a reactive attachment disorder, but it is a relational issue. It is an issue with the relationship between the kid and the parents.
Right. Right. And there is what Barry Brazelton called the temperamental mismatch between the parent anticipated that this is how my child would be, and the child has a very different temperament, and you get into this temperamental mismatch, and you have this friction between these two people that goes across a lifetime. They're from infancy to adulthood.
Yeah. So we need to take a more comprehensive, some recommend taking a more comprehensive view of some of these behaviors, to look at teen behaviors, especially when these oppositional behaviors emerge in adolescence.
Right. That's right. If you're just seeing it for the first time, you're a middle school teacher, and this kid comes into your class and has all these behaviors, and you go to the counselor or the school psychologist, say, what's going on here? And so this is from the Children's Hospital in Boston, and it's a pretty reliable source. We rely on them. It's a group that studies this stuff very carefully, and they've divided it into two categories. One are developmental factors.
Right. Yeah. And again, going back to what we were just talking about, and Barry Brazelton and others who have talked about sort of that goodness of fit between the parent and the child's temperament.
Right.
We don't think about personality in kids, but we think about temperament in kids. And temperament is sort of the foundational structure from which personality is often built, and the way that structure is built often relies on what happens in the environment. And so that's that nature-nurture interplay. But when you have a kid who has temperamental challenges that make them sort of quick to anger, it makes them sort of slow to warm up or slow to make some connections, or they're just difficult because they have that rigid thinking that Ross Greene talks about. All of those sort of developmental factors are at play, and we need to look at that as part of the cause. There's not a we have to be careful not to think about a cause of an oppositional defiant disorder, because if we knew the cause of it, then we'd be able to cure it. We'd be able to fix it. Most disorders that we know the cause, we can prevent it, because we just have to make sure that doesn't happen. We don't know the cause of oppositional defiant disorder. And so we have to look at some of these different things, and these developmental factors are part of it.
That's right. The developmental factors begin with temperament, and different kids have different temperaments. Some kids are easy, some are difficult. And so it may be that these kids who have a very difficult temperament, we have trouble establishing a nurturing relationship with a parent because they are difficult, because they do have a tough temperament.
Right.
So one is, it could just be developmental, just the way this kid is structured. The second is learned factors.
Right. Yeah.
And we can't underestimate those.
Right. Because kids learn from what they experience. If every time dad gets upset about something, he's throwing his phone across the room, guess what the teenager is going to do when he starts getting upset? He's going to throw things. He may not throw things when dad's present because there's probably going to be a consequence, a heavy consequence to doing that. But he's surely going to do that when dad's not present, when he's outside the home or somewhere else. It's so difficult, Richard, isn't it, to when working with parents, because it's like, no, we see this over and over and over and over again. The pattern is irrefutable. I mean, when kids witness those things and experience those things at home when they're growing up, invariably they're going to perform those behaviors as they become adolescents and, again, outside of the home typically. Oh, Richard, you are on mute, I think. So you were talking, but we didn't hear you.
You can hear me now.
Now I can.
Can you hear me now? Yeah, one of the things that we talk that we know is associated with this very oppositional, angry teenager is kids who have experienced excessive punishment,
right?
Whether it's physical punishment or, every time my kid does something, I'm going to take your phone for 2 months. That could be considered excessive punishment for some kids, and they're going to react negatively to that. Okay, right. And so excessive punishment is something that could lead to oppositional behavior.
Right, and it absolutely is the interplay of that experience with the kid's temperament, because you have those kids who have a very passive temperament. Mm-hmm. And so when they experience those things, they become more internalized. So they become more depressed or anxious or those kinds of experiences. Mm-hmm. Kids that have more of a difficult or slow to warm type of temperament, those are the kids that are going to be more oppositional, and they're going to be more defiant as they get older. Right. And it's not that it's predictable, but the pattern is pretty apparent.
Right. Yeah. If you're excessively coming down on your kids, you risk creating that. Okay. Right. Also, they get attention. If I misbehave, I capture my parents' attention. If I do what I'm supposed to do, I don't. Okay. And the third is if there's an early pattern, if the pattern of acting out started very early, and I realize that I get a lot of the attention of my parents, that could be a factor. That's something that a kid learns, that if the more oppositional I am, the more attention I get.
Right.
Okay? And so that could also be a factor. So those are learned. Those are things that kids learn that could also explain why they become oppositional by the time they're teenagers.
Right. Yeah. And there are other factors, because we talked about authoritarian parents. Sort of the other extreme of that is permissive parents. And that too can cause a lot of problems. Parents who just sort of let their kids do whatever they want, don't monitor them at all. Again, you kind of get into that situation sometimes where a parent is permissive, but what they really are doing is not attending. And so the kid will do things that they need to do to get their parents' attention. And oftentimes that's negative things.
Right. That's right. Now, before we move on, so it could be developmental, it could be something about the child, or it could be something the child has learned. Mm-hmm. But one of the things we need to understand before we talk about, okay, what do we do about it, is that it's important to understand that the symptoms of oppositional defiant disorder often include symptoms of other disorders. And the reason this is important, for example, 50 to 65% of defiant children also have ADHD. Mm-hmm. Okay, 35% have a mood disorder, depression. 20% have a mood disorder such as bipolar. We talked about anxiety. So 20% of kids who have ODD also have anxiety, or 35% have depression. 15% develop a personality disorder. Mm-hmm. So we know there's some relationship between oppositional defiant disorder and these other disorders. The reason that's important is because when we decide what we're going to do, we have to know, does the child have a disorder of impulse control, or does the child have a mood disorder or an anxiety disorder? Right. Because that's going to be absolutely essential. You remember Dr. Silver, what he always said to us was, you have to make the right diagnosis. Okay. Right. If you're going to get to intervention, you have to get the right diagnosis. Right. So when you're talking about oppositional defiant disorder, you have to keep in mind that it could be related to some other type of mental health disorder.
Absolutely. So as we think about what to do, the things that we want to avoid, when we started talking last week about what is, if a behavior is abnormal, we needed to start out by thinking about what is normal. When we think about what to do about it, we need to start out with what not to do.
Right.
When we think about what not to do, the first thing is avoiding power struggles.
Please. Yes.
It is so difficult for some parents to accept, but there are some things that you're just not going to be able to make the kid do. If they don't want to, you're not going to be able to make them do it. I mean, how many times have we heard stories about kids who will sit at the dining room table for 50 hours and just absolutely refuse to eat, their vegetable if they don't want it, or they will, they will just adamantly refuse to do homework or something. It doesn't matter what the consequence is. And where that's coming from is that there is this power struggle, and the parent doesn't want to give in, but when it comes to some of these behaviors that you want your kid to do, if they don't want to do it, they're many times they're just not going to do it.
There's a wonderful commercial now. I think it's a macaroni and cheese commercial. This little girl, she's about 8. Fine, then I'll sit here all night. They're happy to go to work over that kind of stuff.
Right.
They don't care.
Yeah, and that's, if we're not careful, that's where the emerging other disorders like eating disorders and things like that can come from, because now all of a sudden you have this power struggle, and it's like, well, you can make me do all of these other things, but you can't make me do this. Right.
That's right. Right. And so please, whatever you do, because having power is sort of an intervention. Right. You're going to do it because I told you to do it. Right. That's an intervention. You're doing it because I told you to do it. I made you do it.
Right.
It's not, you're not going to win those battles.
Right.
You might win a battle, but you're going to lose the war.
Right. Okay. And similarly, you can't reward and punish kids with oppositional defiant disorder. You just, there's, and I get into these discussions with people at schools all the time, Richard, and it makes me want to pull my hair out, because they'll say, well, no, look, when you give him this, he wants that, so he'll behave. Yes, he wants that right now. But then tomorrow, he doesn't want that. He doesn't want to play with the Play-Doh. He wants the Legos today.
Right.
And no, he doesn't want the Legos today. He wants you to give him money today.
Right.
Because it just keeps going up and up. And so you're not going to be able to reward or punish the oppositional defiant disorder out of these kids.
No, you're not going to do it. You can't punish it out of them, and you can't reward it out of them. It's just not going to work. We can give you 1,000 reasons why, but take our word for it. It's not going to work.
Right. So when we think about, so we avoid those things. We avoid the power struggles, avoid trying to reward it out of them. We got to avoid trying to punish it out of them. When we think about treatments that we see, oftentimes people will talk about medication, and we should start this out with, there is no medication for oppositional defiant disorder. Instead, what psychiatrists and physicians will do is they will attempt to approach it from either the perspective of it being sort of an impulse control problem, like with ADHD, or they'll treat it as some form of anxiety or mood-related disorder, like depression or something like that, and they will prescribe medications to manage mood stability. One of the anger outbursts, for example, is a big challenge for a lot of kids. There's no medication for that. No. But a medication that is FDA approved to help with irritable kids is like Risperdal, which is an antipsychotic medication. Right. But it's a medication that helps decrease, it decreases irritability. It stabilizes mood. It doesn't make you not angry. It just stabilizes mood, so it's more difficult to become angry. That's right.
Yeah, there's no medication for the symptoms for ODD. There's no medication for teasing your sister, or for being annoying, or for being oppositional. But we can approach it from those two standpoints. Am I looking at a disorder of impulse control, Do I think that's what's causing my child to be oppositional? Is that he can't control his impulses? Or am I looking at an angry, irritable child who has a mood disorder? Now, if that's the case, then we have medication for impulse control,
Right.
and we have medication for mood. Okay,
Right.
but it's not always going to be clear what we're dealing with. If it
Absolutely.
is, then we have those two approaches. But chances are there are going to be other factors involved, and so we have to take a more comprehensive approach. And because you're not going to get a medication for ODD. Okay, so it's going to take a more comprehensive approach. And the Mayo Clinic, which is another group that we rely on for reliable information, has an sort of has a multi-pronged approach that has interventions that you use for the teenager, interventions that you use for the parents, and interventions that you use for the family, because it's going to require all three.
Absolutely. And these interventions should make sense, right? So they, we start out with parent training on how to best manage and respond to oppositional behavior.
Right.
So, they talk about having a more consistent and more sort of positive leaning environment for the kid and for the family.
Right.
And so it begins with that parent training
Right.
as the foundation.
Yeah, when we said earlier that you can't punish or reward these kids into compliance, into submission, you're not going to do it. There are other things, but most of us don't have access to those other things. So you're going to need to be trained how to be a parent for this child. Right. Because the typical parent things that we use don't work with these kids. Okay, right. They just don't work, and punishment and rewards are part of that just don't work. And so you're going to need to get advice from other people about how to parent this child. One of the things that, and I was a little bit reluctant to put this in, there's a strategy called parent-child interaction therapy, PCIT. But this is something that is under very controlled circumstances, and you put the child and the parent in a room, and the parent has an earpiece so you can talk to the parent and the child doesn't know, and you correct the parent as they're interacting with the child. That takes a lot of structure, and most of us don't have that structure. But what we can do is we can have the parents walk us through a scenario. Mm-hmm. And say, okay, tell me what happened at the dinner table last night. Mm-hmm. What did your child do? And then what did you say? And you can take those scenarios in an office setting and mm-hmm. say, okay, next time that happens, let's try this. Right. Okay. So, and that's a more practical way of doing parent-child interaction therapy.
Yeah. And you also, something that I know that we both have done is have the parent and child sitting in front of us and right. have some of those discussions and say, oh, whoa, wait a minute. Okay, so this is where we're going to go off onto this. This is what's right. going to happen next. So let's stop that and go in this other direction. And right. and that interaction between the parent and child. And the real difficulty here is the reality that because by the time you have a teenager, the parent has been doing what the parents will come in and say, this kid has been doing this for so long, right. and they just won't stop. Mm-hmm. And what they're failing to recognize often is that the parent has been doing what they're doing for so long that they're pretty resistant in changing as well. And so the parent is going to have to make some changes. There is nothing that I can do to change the kid if the kid is just going to go back into the same environment where everything is happening just as it has for the last 15 years of his life. Mm-hmm. Everything has to change. And that's sort of this Mayo Clinic approach that you can't just, the third prong, of course, is individual therapy for the kid. Right. Individual therapy for the kid isn't going to change things, at least not in any expediency. It's not going to change quickly because the environment has to change. Everything has to change.
Yeah, many times parents or teachers or partners, because it happens in family therapy, it happens in couples therapy as well, is that you say, well, I want my child to change. I want you to change my child. Okay. And what you're asking us to do is you're saying to us, as a parent, I'm going to continue doing what I do. Mm-hmm. I want you to change my child. So what I have to say to the child is, look, your dad is not going to change. He's not going to do anything. You have to do all the changing. How many kids are going to accept that? We're talking about a kid who's already oppositional.
Right.
How many kids are going to say, wait a minute, so it's okay for my mother to call me names and to punish me and take my phone for no reason and to blame me for things that I'm not doing, but I have to do all the changing? That's what you're asking us. Okay.
Right.
So no, parents also have to change. Like it or not, you have to change, because you can't expect no child is going to accept that, particularly a child with ODD.
Right.
This is an interaction between the two of you. Parents say, well, it's always arguing with me. They can't argue unless you're arguing back.
Right.
I mean, don't give them somebody to argue with.
Right.
Well, I'm the parent, I'm allowed to do it. Okay, but you do that with your other children, it's okay, maybe. Okay.
Right.
But this child is different and is going to require a different approach.
Right.
So parent training is absolutely essential.
Right. And again, it's the failure of the parent to recognize that they may be contributing to what's going on.
That's right.
That's difficult.
Exactly. And because it is an interaction. I mean, what are we talking about? We're talking about a kid who's creating havoc in the household, which consists of parents and siblings.
Right. Absolutely.
So and when we get to individual therapy, we're talking about there are two that are commonly used and have been shown to be effective. One is cognitive problem solving, which is sort of cognitive behavioral therapy, where you challenge the child to change their thinking. Mm-hmm. Okay, what do you mean your dad hates you? So you're basing your decision on a parent hates you. Is that an accurate assumption that you're making? So you change the child's thinking, so they change the behavior. The second type is collaborative problem solving. Mm-hmm. Collaborative problem solving is parent and child working together to develop a solution for the problems that they're having. So you can see that we've shifted from reward and punish mm-hmm. to collaboration and cooperation.
Right.
And that's what we do with these kids. The individual therapies are more collaborative.
Right.
There's a caveat here, which we're going to talk about later, but you have to rely on these kinds of approaches because the typical approaches are not going to work.
Right. And in that sense, that's where we get into like family therapy, where
That's
you're
right.
working with the kid and with the parents together.
Right.
Not just
and the siblings.
Right. Absolutely. Not just to see what those dynamics are, like that parent-child interactive therapy, but working with to kind of work through this process. And so that's where you have that family therapy piece. And sometimes we have to teach social skills and to the parents and to the kids to help them understand how to interact and how to engage with others.
That's right. One of the hallmarks of oppositional defiant disorder, we've repeated it throughout, is these kids tend to ignite very quickly. So as a parent, you don't want to do anything that would create that ignition. Okay, so that's why we need to understand how to do this, because it's very easy because you do the normal parenting things, but in these kids, not only does it not work, it actually creates problems.
Absolutely.
Right.
Now, so we're going to wrap up today's podcast with a talk with some things that can be done in the home right now. Parents can start to implement and to make some adjustments to try to help manage some of these things, sometimes to help prevent some of these issues and sometimes to help just respond to them appropriately. Right. And so, when a parent is experiencing, is managing their oppositionally defiant teenager, one of the things that, the research suggests is can be powerful is the importance of recognizing and praising positive behaviors. Mm-hmm. Richard, how many times have you talked with a kid and it's like they feel like all they do is negative because all they ever hear are redirections? No, don't do that. You're wrong. No, that's all they hear. And so sometimes kids just need to hear positive things. Right.
And I don't like using praise as a candy, as a star, as a sticker. Right. We're not talking about that kind of praise, like, oh, honey, you did such a good job. Don't do that. That's rewarding. And that doesn't work with these kids. We talk about recognition and praise. If you said something to your child like, hey, I really like the way you did your homework tonight. What you're doing is you're saying to the child, this is how I want it to look. That's all you're saying to the child. And the child says, oh, okay, so that's what they want.
Right.
Now I get it. Okay. What I did. Okay. Now I understand. So it's not that you're patting them on the head. It's that you're telling them, this is how I want it to look.
Right.
Okay. And that a kid can understand.
Absolutely. And going along with that is the idea of modeling the behavior that you want the kid to perform. Parents will say, go clean your room. And the kid will go in there and they'll come out and they'll say, I'm done. And the parent will say, no, you're not. Get back in there and finish cleaning your room. And the kid will go back in there and they'll come out a little bit later and they'll say, okay, I finished. No, you're not. That's not where that's supposed to be. You need to go back. And so it's like a trial and error. And it doesn't take long before the kid is like, okay, I'm not going to do this anymore. This is crazy. This is fine to me. I live in this room. I sleep in this room. This is my room. How many kids say that? I'm not going to make my room like what she wants. But part of that is because he has no idea what she wants. The behavior hasn't been modeled. So you have to, I think you're on mute again, Richard. So you have to model that behavior so that the kid knows what it looks like.
Exactly. If you want your kids to apologize to you, you have to demonstrate apologies to them. Okay.
Absolutely.
If you want your kids to be kind and to speak softly, and we often hear parents say, use your indoor voice, while they're screaming at the kid. Okay. Right. The kids are going to do what they see, not what you tell them. Okay?
Right.
So model the behavior that you want.
Right.
If you don't want screaming and yelling from your child, then don't model screaming and yelling to them. Okay? Absolutely. And we said earlier that you avoid power struggles. You also have to pick your battles. I mean, I frequently say to parents, look, forget about all this stuff. Let's just work on one thing. Okay, let's get this. Let's take the low-hanging fruit. Let's take what am I going to do? But don't worry about that right now. Okay. Right. Let's just do this. If you can't get your child out of bed in the morning, don't worry about everything else. Let's just accomplish that. Okay? Right. Let's do one thing.
Yeah, parents come in sometimes to the office, and they're dealing with their kids sneaking out of the house in the middle of the night, or doing all these negative things, but yet then they'll still fight about cleaning the room. It's like, whoa, wait a minute, you can't fight about that, or that he's not putting his dishes away, or he's leaving the towel on the floor. Wait, why are we fighting over that when we have these huge issues going on? Right. We can't fix everything all at one time.
Right. Or the example that I frequently use with parents is, you ask the child to clean her room, and that's all you want. That's the goal, is to get the room clean. And she gives a sigh of disgust, right, and says something like, "This is so stupid." And then the parent now goes after, you're being rude and disrespectful. Right. Okay. So right, you have one fire burning to get the room clean. Now the child does that, and you react, and that sets a second fire.
Right.
And then you challenge the child, say, you can't talk to me that way. And the child says, oh, shut up, I can do it. Now you got a third fire burning. Okay.
Right. Or the parent will say, this is just the one thing that I ask you to do. You don't have to do anything else. What do you have to be so angry about all the time? Where does that come from? Again, we said this at the beginning. I don't necessarily like cleaning my room. I don't like washing the dishes. I don't like mowing the yard. Some people do. That's great. Right. I don't like doing it. And so when I have to go out and do it, I feel the same way. I'm right there with you. God, I hate doing it. But hey, but this is why we maintain it, right? I don't wait 3 months in the middle of summer before I mow the yard again, because if I do, man, it's going to be a huge challenge.
Right.
Don't wait 3 weeks before you clean up your room. Just put things back where they go, and then it won't be difficult. But that's the lesson. Instead, we turn it into a power struggle.
Right. And again, before things accelerate, you want to set limits. Okay. You want to have very clear limits about what is and what isn't allowed. But you don't want to set those limits during a confrontation. And that's what many parents do, say, well, from now on, this is how this is going to be. That's not the time to set limits. Set limits when everybody's calm. That's the collaborative problem-solving approach.
Right.
Sit down when everything's calm and say, honey, this is what we have to do, and you reach that agreement. Because these kids are not always out of control.
Right.
They're episodically out of control.
Right.
So when things are calm, then you can start setting these limits. Don't try to do anything during the heat of battle.
Right. And similarly, you want to have a good routine. We talked about this a little bit last week, is the more consistent and predictable the environment and the daily schedule, the daily expectations, the easier it is for the kid and for you to manage things. If kids are going to be oppositional, if all of a sudden, they're in the middle of something and all of a sudden you make them stop to go do something else. It's one thing if that's on occasion every once in a while. It's a different thing with some families where that happens almost every day.
That's right. I think the starting point for most of the families that I work with is they have to set up a better routine. Because what you're doing, what many families get into is it's an incident by incident relationship.
Right.
Is you're constantly fighting about things throughout the day, and what you're fighting about are things like getting up in the morning, going to bed at night, brushing your teeth. You have to set those routines early, and if you can't set routines, it's unlikely that you're going to be able to accomplish much else. I mean, if you can't get your child to get up in the morning, don't worry about how they talk. I mean, that's just one of many problems that you're dealing with. So you have to be able to set up these routines. Once you have a routine, then you stop fighting about this stuff. Right. I mean, if you know that every day at 7 o'clock, I have to get out of bed, if you do that every single day, eventually it's going to become the way we do things in our family.
Right. And part of that routine is building in time to spend together as a family. And that can be everything from, we're going to sit and play a board game tonight, or we're going to, today we're going to clean the house, but we're all going to clean the house together, so you can spend time together with enjoyable things, but even work together. But that stuff has to be set up. Yes, you're going to get to a point where your teenager doesn't want to spend that kind of time with you, and that's fine. But, to say, well, we're at least going to have dinner together. We don't have to sit around and play board games or watch a movie together. Most teenagers will be happy to watch a movie with you if it's a movie they want to see. But build in some time together, even if it's just working together.
And it's, Russ Barkley talks about that. I think it's step 4 in his 8 or 9 step process with kids who are disruptive and defiant. And one of the things he talks about is special time with your child where there's no teaching involved. There's no moralizing, there's no teaching. It's just fun time together. I know one of my kids liked to go fishing. And so that was the one thing that invariably she would agree to do. Okay. Other kids will watch a movie. Other kids want to go shopping. And so spend quality time where there's no teaching so that you have a positive reference that you can say, hey, that was really fun. That was really good. That was really a good time. So that your child has more than just punishment and negativity for every interaction. There are positive interactions.
Right. And what goes along with that is, figuring out what the kid enjoys, but also letting the kid have some choices. So let them choose what their chore is. If you need them to, if these are the 5 chores that need to be done, have them, identify, would you rather take out the trash or would you rather clear the table?
Exactly. What chore do you want to do? Here they are. Somebody has to do these things. Which one do you want to do? Everybody has to do something.
Right. But I think the most critical piece is that parents, you have to be prepared for some of these challenges. You have to be prepared for it early on. Again, a lot of this stuff is going to be typical, so you be prepared for it as they're growing up, but you also have to be prepared for it in the moment. Oh my gosh, plans are going to change tonight because I wasn't expecting this. So I know he's going to have a hard time with this change in routine for tonight, because he's going to be expecting to come home from school and play video games, and he's not going to be able to do that because we have to go to the store. Be prepared for it and calm yourself. Take care of your own stress and frustration and everything with it. so that you don't become just as reactive as he's going to be.
Right. There's another thing I want to mention about chores. This is a frequent problem that we deal with. Is a child has a chore, typically clean your own bathroom. Okay, and so the child goes in, cleans the bathroom, but it's not done the way the parent wants it to be done. Okay, because parents are better at cleaning than kids are. Okay, so the parent goes in to inspect. We have this inspection tour, and the parent says, "Oh yeah, you cleaned it, but no, you didn't do it right. You didn't do it properly." This is another one of those places where I just want you to clean the bathroom. Cleaning it perfectly is a different issue. Cleaning it to my satisfaction is a different issue. So let's start with, okay, you're in the habit of cleaning the bathroom. You're not yet doing it the way I want you to do it, but you're in the habit of doing it. Now that we have the habit built in, now we can start honing that down to get it the way you want it to be.
Right.
And that's mowing the lawn, cleaning a bathroom, running the vacuum cleaner. I just want you to do it. The first step is just make it a routine. Right. Then we can talk about how well you're doing.
Right. And that's where the modeling piece comes in, where the parent shows, this is how I want you to do it. And so, working together, doing those chores together sometimes helps with that. So,
right. Yep.
All right. Well, I think that's it for today. This was a bit longer of a podcast than we typically have been doing lately, but hopefully it's a lot of good information. We're going to talk more next week about some other interventions and strategies for kids and teenagers with oppositional behavior, because we've heard from some listeners who are asking for more specific recommendations and ideas and strategies and stuff. So we're going to try to provide some of those. But hopefully this was a good start for everyone, and we'll be back at it. But know that we do listen and we do hear your questions and what you're in need of, and we're trying to respond accordingly. Yeah.
Okay.
All right. Well, that's it then for today. Until next time.
Raising teenagers, right? It's not for the faint of heart.
It's not. All right. That's it for today. Until next time, stay happy, stay healthy, and forget to be afraid.